This is a WDIO News Special Report.
Hand the conference over to your speaker today, Mike Schumer. Thank you. Please go ahead.
Thank you, operator, and thank you for joining us for the COVID-19 daily media call for May 15th. Governor Walz is not on today's call. We'll be starting with a situation report from Commissioner Jan Malcolm. Following that, we'll get an update from our state epidemiologist, Dr. Ruth Linfield. Following Ruth, we'll get an update from MDH Infectious Disease Division Director Chris Erzman. After those opening updates, we'll open it up for questions from reporters on the line. With that, I'll now turn it over to Commissioner Malcolm.
Thank you, Mike, and good afternoon, everyone. Quick data brief again. Globally, as of this morning, we were at more than 4.4 million cases and 302,000 deaths. In the United States, as of this morning, we were just over 1.4 million cases and 85,000 deaths. In Minnesota, we have a new total of 14,240 cases, which is up 808 cases from the prior day. That is our single largest day-over-day increase. Despite that high number of new cases, we still are at a 12-day doubling rate for a total number of cases, which is an improvement over last week. And unfortunately, we lost 20 additional Minnesotans to COVID-19 from yesterday. We had, among these deaths, 8 in Hennepin County, 5 in Ramsey, 3 in Anoka, 2 in Itasca, 1 each in Carver and Dakota. This total includes 1 person over the age of 100, 3 in their 90s, 10 in their 80s, 1 in their 70s, 4 in their 60s, and 1 in their 50s. 17 of these individuals were residents of long-term care facilities. I'd like to take a moment also to call your attention to an order that Governor Walz just released shortly ago. He has directed that all flags at state and federal buildings in Minnesota will be flown at half staff from sunrise to sunset on the 19th of every month through 2020, starting with next Tuesday, May 19th, to remember and mourn and honor all the lives lost to COVID-19. I think it's a wonderful way to remind us that these are not just numbers. Going through these numbers every day, one can almost become numb to the fact that they represent, every one of them, a loved one and a family member and a neighbor. So I thank the governor for that acknowledgement and that way of reminding us all how serious this outbreak is and what the stakes are for all of us to continue to be part of the effort statewide to keep these numbers as low as we can. There are 498 patients currently in the hospital, which is a net change of 0 from yesterday. 3 fewer people in intensive care. So that net 0. I would like to also just make mention of the fact that we had our second highest testing day yesterday. So we had 808 new cases on a testing volume of just under 6,000, 5,890 to be specific, lower than the day prior, but still our second highest testing day. Again, we want to remind Minnesotans that people who have symptoms of COVID-19 can and should be getting tested. And again, that basic message, when you test positive and or if you even feel sick and before you're able to get a test, please self-isolate. That means staying at home. Nothing about the new stay safe messaging means that we should be out and about when we're ill. Staying home when we're sick is a fundamental part of our Stay Safe Minnesota strategy. With that, I would like to turn it over to Dr. Ruth Linfield for an update on a Health Alert Network message that was just issued this morning. Ruth.
Thank you very much, Commissioner. We sent a Health Alert message out about a new condition that was originally recognized in Europe and then in New York, and now is being seen in other geographic areas. This is the multi-system inflammatory syndrome in children. And we do think that there may be a connection with SARS-CoV-2. We sent the health alert out because we have heard that there may be some cases in Minnesota, and we would like to get the reports and be able to find out if it is occurring and how frequently it is occurring. This is a syndrome that children have presented with fever. They have presented with signs of inflammation. Many of them have had abdominal pain, diarrhea, or vomiting. Many of them have had manifestations that are very similar to a syndrome called Kawasaki's disease, in which there can be red cracked lips or red tongue. There can be a rash. There may be swollen hands and feet. There can be red or pink eyes. And what people have been noticing with these children, however, is that some of them are getting very severely ill. That's the multi-system component, where they have more than 2 organs having evidence of having involvement. And many of them have had heart involvement, but also kidney, lungs, blood, gastrointestinal tract, neurological manifestations, and I did mention rash. Some of these children are positive by PCR for SARS-CoV-2, the virus that causes COVID-19. Some of them are not positive, but when a blood test was done to look for exposure to this virus, they were found to have antibodies to the virus consistent with exposure. So we are learning more about some of the complications that may be occurring. And so we need to look into this more, but certainly in some children there has been this connection. Other children have had family members who a number of weeks prior were ill or they were ill. And so in some children it seems to present a number of weeks or even later than symptoms that are consistent with COVID-19. And again, many of them have had gastrointestinal symptoms. So we are asking clinicians and parents to keep an eye out for this. Certainly if parents have children who develop fever and some of these signs and symptoms, we urge them to contact their clinician and discuss it with them. With that, I will turn it over to my colleague, Infectious Disease Director, Chris Ersman.
Thank you, Ruth. I'd like to talk a little bit about Stay Safe Minnesota. As we anticipate the lifting of the stay-at-home order on Monday, I want to take the opportunity to remind you of the importance of social distancing. As you heard, we are continuing to see COVID-19 cases increase in Minnesota. And this makes it very important that as the governor loosens up some of the restrictions, that we continue to follow social distancing guidelines that we have been sharing with you. Maintain a distance of 6 feet between people, wear a cloth mask when you're out in public, and don't gather in groups of more than 10 while maintaining social distancing. it's really important that we are responsible with these community mitigation measures as we move into this new phase. I also want to address the question that has arisen of visiting friends and family in long-term care settings. The new guidance does not change the current limitation on visitors at long-term care settings. Visitor restrictions remain. The only exception is for compassionate care situations. Keep in mind that as licensed, registered, or certified providers of care, these facilities are required to be in compliance with current regulations, which prohibit visitors. And while we're talking about long-term care, I just wanted to clarify a couple of things that have come up since our conversation yesterday when we were talking about the ramp-up in testing in our long-term care facilities. Our Minnesota National Guard is assisting with some of the testing. And I want to reiterate that the testing teams from the National Guard are made up of 10 members each, with a combination of Army and Air National Guard personnel. The members that are conducting the testing are trained medical professionals, and they serve in duty assignments that are medical in nature. Many of these members work in the medical civilian capacity as well, and they possess and maintain national certifications as emergency medical technicians. So I just wanted to reiterate that. I know there have been a lot of questions about that since we talked about it yesterday, and so just wanted to clarify that we are talking about National Guard members with a background in the medical field. And so just to conclude, we want you to enjoy the weather. We want you to look forward to Monday, but we want you to stay 6 feet apart, wear a cloth mask when you're outside of your home, and don't gather in groups any larger than 10. And with that, I'll turn it back to Mike Schomer.
Thanks, Chris. We'll open it up for questions now, and as we do, we'll ask that reporters limit their questions to one primary question and one on-topic follow-up. We'd also like to ask that you limit the number of questions from each outlet so we can get to as many outlets as possible. With that, operator, we are ready to take questions.
Thank you, and ladies and gentlemen, if you would like to ask a question, press star 1 on your telephone. For our first question, it's from Jeremy Alton from the Star Tribune. Your line's open.
Hi, I wanted to ask about the new dial measure of percent of cases with no known exposure. I wanted to get first a little more explanation on why that's a measure worth watching. Why do we care about that? Why is that going to make a difference, and why are we keeping an eye on it?
Great. Either Chris or Ruth. Chris, why don't you start, and then Ruth, if you have anything to add, please do.
Certainly. When we talk about someone who doesn't have a known exposure, we're assuming then that their exposure to COVID came about in a community setting. So if we know that there is an outbreak associated with a particular plant or a particular, say, long-term care facility, and we see additional cases in those facilities or those locations, we know that that transmission is linked to what's happening in the facility. When we hear about someone who says, you know, I don't know, I just went to the grocery store and I, don't know of any other exposures, that's significant because that's talking about what is circulating and happening in the broader community. And so we want to be attentive to that. It's not that we don't care about what happens in settings where we know there are cases or that we know that an outbreak is happening, but we also are attentive to what we're seeing circulating more broadly or diffusely in the community.
And my follow-up question, unless someone else has a comment on that, is about the 30% break point you're using for your measurement. Is there any evidence of 30% being a meaningful statistic? And it's already above that, so what are you going to do to push that down? So if you could answer those two, that'd be great.
This is Ruth. It really is a sense of, especially when we're interviewing cases and trying to identify their high-risk contacts, when we come across cases then that don't have a contact, it tells us, as Chris articulated, that the virus is circulating, and it means perhaps there's a higher level, that we've lost the epilink, so to speak. So it is of concern. So with the attention to increase case interviews and contact tracing and all that, we do want to bring that measure down. We want to be able to control transmission within the community.
But why 30%? Is there any evidence to support that as a meaningful threshold?
That was our best guess, Jeremy. There is a lot we don't know, and so what we have said is we are coming up with metrics and measures, and we will refine them if it seems that that is not a great measure. But we want to diminish the number of cases that don't have this link. And so we thought that coming up with 30% or 33%, a third, that was an amount that we felt we really, we wanted to be able to diminish the number of cases, and it's a balance between what is possible and what is aspirational.
Thank you.
For the next question, it's from Brian Arula from the Mankato Free Press. The line's open.
Hi, thank you. Yesterday you provided an update on how many of the COVID-19 deaths in our state occurred among people with underlying health conditions. I'm wondering what have been some of the most common underlying health conditions among those who died? Are you noticing any more prevalent ones?
Chris, you want to start? And again,
Sure.
Bruce, please chime in if you have something to add.
There are certain conditions that we are asking about as we're doing interviews. So we're looking at underlying health conditions such as asthma, diabetes, chronic kidney, liver, or heart disease, and an immunocompromising condition. Those are all some of the things that we're looking at as it relates to underlying conditions. And I'll let Ruth add to that.
Yeah, I agree. And of course, another component when you look at the deaths, too, is that they tend to be older individuals. And often what we see is that there are people who have not just one medical condition, but they have multiple medical conditions.
Okay, thank you. And then as a follow-up, can you give us maybe an idea of how common these underlying health conditions are among Minnesotans, the overall population? Are we talking a fairly sizable percentage who might have one or more of these?
Yes, the estimates are, over 30% of the population, and I can dig that number up. But it's a fairly significant proportion of the population, and that's why, when we've heard questions, well, if you're seeing, deaths and hospitalizations and people with underlying health conditions, why don't we, just target things? Why was the whole state, in a shelter at home? And what we need to keep in mind is that this is a large portion of our population, and so we're working collectively. It's not just individuals who may reside in a long-term care setting. This is a big portion of our population, so our decision-making needs to take that into account.
And this is Ruth. I did just want to add a couple of other thoughts. I am not sure whether Chris mentioned obesity or not, but that also is a condition that we're seeing in many of the individuals who have severe disease. And I also want to point out, though, that there are, in fact, some hospitalized patients who are younger and who don't have underlying conditions. So certainly, if you are elderly And if you have underlying conditions, you're at a higher risk. But that doesn't mean that young, healthy people don't get severe disease. And so that is another reason why we have to take this virus seriously. Thank you.
And I'll just say that this is a study by the Henry Kaiser Family Foundation, but they found that about 34% of our population, 18 and older, had a high-risk underlying risk factor.
Okay, thank you.
This has been a WDIO News Special Report.